Hi, I'm Kathleen Moore. I'm an assistant professor of gynecologic oncology at the University of Oklahoma Stephenson Cancer Center here with Sarah Cannon Research Institute. So I take care of women with gynecologic cancers, and they're mainly four main cancers with a few that are more rare. We take care of women with ovarian cancer, women with cancer of the uterus, so that's either endometrial cancer or uterine sarcomas. We take care of women with cervical cancer, and women with vulvar cancer, and then more infrequently, women with vaginal cancers and some other rare subtypes. So the most common gynecologic cancer, of course excluding breast, which is more of a women's cancer, but the most common gynecologic cancer would be endometrial cancer, or cancer of the lining of the uterus, which is the womb. This affects about 40,000 women in the United States each year, but fortunately in large part is very curable with removal of the uterus alone. And this is because this is one of those cancers that is typically caught very early. Women with endometrial cancer present with bleeding after menopause. So any woman who's gone through the midlife change and has stopped her periods, who starts having periods again, this is an abnormal finding and should be evaluated. It's more often than not cancer, but that is the warning sign for endometrial cancer. And it happens very early. And so women present, they get biopsied, and their treatment is generally a hysterectomy and oophorectomy. Sometimes we'll do lymph nodes. And then in a subset of those women, they may need some adjuvant or additional therapy, such as radiation, but that very much depends on the findings at the time of surgery. About 15 to 20% of patients will present with advanced disease, which is a little bit more difficult to treat and requires sometimes chemotherapy in addition to radiation therapy or chemotherapy alone, but those treatments are decided on a case-by-case basis. But in large part, these patients present with early stage disease and are highly curable. Really, the incidence of endometrial cancer in the U.S. is increasing. This is a hormonally driven cancer related to estrogen exposure. Estrogen exposure is increased in women who carry excess abdominal weight. So with increasing obesity comes increasing risk of endometrial cancer. And so we're actually seeing an increase in the number of these cases that we see each year just because of the increasing weight we see in this country. So cervical cancer is cancer of the cervix, which is the opening of the womb. So it's connected to the uterus, but is actually a separate tissue. This is what gets screened for with the Pap test. So the Pap test does not test for uterus cancer, it does not test for ovary cancer, it only tests for cervix cancer. But this is the screening test for cervix cancer. And because we have this screening test, we actually have very little cervix cancer in the United States in this day and age. There's about 10,000 new cases a year, so this would classify as a rare tumor in the United States. It's not true in the rest of the world. But here it is, and there are patients who develop cervix cancer who've undergone appropriate screening. Sometimes screening fails, but in large part, women who present with cervix cancer in the U.S. in this day and age are those who just don't follow screening recommendations. When cervix cancer is caught early, it's treated with what's called a radical hysterectomy. So it's removal of the uterus and cervix, but it's a very different procedure than one done for a non-cancerous case. It's a bigger procedure, more surgical risks, but in large part is curative. When cervix cancer presents in more advanced stages, it requires radiation and chemotherapy, not a hysterectomy. The cervix is actually left in place and radiated, and those are harder to treat. And so even though there's only 10,000 cases, the fact that we still have women in this country who are unscreened is a problem. Risk factors for cervix cancer are well known. It's the human papillomavirus, which is a sexually transmitted virus. So if you've had more than one partner or your partner's had more than one partner, then you've likely been exposed. With regular Pap screening, you'll catch these lesions long before they become cancers, but left unchecked, they can develop into cancers. These tend to be diseases of younger women, 30s and 40s, although that's not entirely true. We certainly see them in postmenopausal women, so I would not say it's just a disease of the young. In postmenopausal women, the key finding is going to be, again, postmenopausal bleeding or pain. In premenopausal women, The presentation is irregular bleeding, bleeding that is not monthly with the regular cycle, bleeding after intercourse or sex, increased pain with intercourse, can all be signs that something's going on with the cervix and warrant an evaluation with a gynecologist. Vulvar cancer, these are the cancer of basically the opening of the vagina, the lips of the vagina. These are very rare, 5,000 cases in the United States each year, mainly a disease of women in their 70s and 80s, although with the increase in human papillomavirus, you actually are seeing, just like cervix cancer, increasing vulvar cancer in younger women. And so, again, we can't ignore symptoms in either population. Patients present with anywhere from just some itching on the outside of their vagina to a lesion that they can feel, a mass that they can feel, a bleeding mass, a painful mass, to much larger lesions when they have gone unchecked. So again, the message would be know your body. Things that are abnormal or changing are likely things that need to be evaluated by someone who's trained in doing a pelvic exam. Vulvar cancers are treated. We prefer with surgery. We just excise, cut out the cancer and sew things back together. We test lymph nodes. And when the cancer has spread, we have to treat with some radiation, but that's primarily a disease that's treated with surgery. And if caught early, cure rates are very high. Again, like anything, vulvar cancer that's left to grow and become incredibly large and has spread to lymph nodes is a more challenging disease to treat. But fortunately, those are very uncommon tumors in this day and age. So ovarian cancer affects about 22,000 women in the United States each year, which actually, when compared to breast and colon cancer, is a very small number. But ovarian cancer is very important because even though not many women are affected, it presents at a very late stage in the majority of women who are affected, and their prognosis is comparably poor. And so this isn't a disease that's easily cured. It isn't a disease that we have a good screening test for. And so it is the focus of our clinical trials efforts, and really a lot of the national efforts, National Cancer Institute effort and initiatives are directed at ovarian cancer screening development and better therapies for ovarian cancer patients. Ovarian cancer probably does have symptoms early in its course. The problem is that they're very similar to very common symptoms that every woman has. So bloating is very common. Women may report excess burping, feeling full early, having some pelvic pain, maybe some changes in how they are having bowel movements or how they're urinating. So these are all symptoms that any one of us could have on any given day related to any number of things that are not cancer. And so they are often ignored for several months. Typically, women report symptoms retrospectively for about 3 months prior to diagnosis, just because they weren't symptoms that raised anyone's alarm until they became severe. So when women have new symptoms of abdominal bloating, feeling full early, abdominal pain, the recommendation is that they see their physician and make sure that they're insisting on a pelvic exam as part of the evaluation. The likelihood is that it is not ovarian cancer, but we certainly want to catch those in whom an ovarian tumor is the reason they're having these symptoms.